If you want, you can see because all this. By pencil.
Okay, good. I should start. Good afternoon, everyone. Today I'm talking about acquired immunodeficiency syndrome, in short form known as AIDS. So, AIDS is a syndrome, or is a condition caused by the human immunodeficiency virus, which is main etiological factor. Human immunodeficiency virus is known as HIV. So what HIV does is that it basically attacks our immune system, specifically the CD4 cells, and which are like the crucial cells for fighting infections in the body. Over time, as HIV destroys these cells, the body becomes more vulnerable or susceptible to like infections because we can't fight against them anymore, and certain cancers as well. And if HIV is basically untreated, it can progress to AIDS, which is the acquired immunodeficiency syndrome. It's normally in the final stages of HIV infection, and it's characterized by a very weakened immune system or immune state. Okay, a little about the history of AIDS. The history of AIDS basically dates back to the early 1980s in the United States, but it has always been there prior to that time, but it wasn't just discovered, or it wasn't really prominent at that point until the 1980s. The disease was a very poorly understood disease and led to a lot of stigmatization or discrimination from people of the society and communities. And in 1983, researchers then identified the HIV cause, which is the virus, and some other key milestones in the history of HIV or AIDS include the development of the first HIV test in 1985, the introduction of highly active antiretroviral therapy, which is basically the main method of treatment still being used to today, in the mid-1990s, and a global initiative for prevention and treatment, significantly improving life expectancies for people living with HIV. Okay, the pathophysiology of HIV or AIDS. HIV basically, pathophysiology has to do, or it involves a complex interaction of the HIV virus and the person's or the host immune system. There are like 4 stages. We have the viral entry and replication. HIV here primarily affects the CD4 to the T lymphocytes, like together, T lymphocytes and T lymphocytes. And the virus attaches to the CD4 receptors and the co-receptors on the surface of these cells, allowing it to enter. Once it's inside, the HIV's RNA genome is reverse transcribed into DNA and integrated into the host genome. Here you can see the HIV virus fusing with the other cell of the host body. You can see. When it enters into the host cell, it releases its own genetic material, and after this, it normally integrates itself into the host genome or the DNA of the host, where it can then replicate itself to produce small HIV cells. And when it does this, it can then leave the cell. After producing more proteins, it can leave the cell and then also go and affect other cells of the host body, which can lead to the multiplication of more and more viruses. And then the second stage, which I've already explained, but I'll still talk about it, is the destruction of the CD4 cells as the HIV replicates. So when HIV basically replicates in the after entering into the genome of the host, it replicates and causes destruction of CD4 cells, either directly through viral replication, like I say, and cell lysis, or indirectly by inducing immune responses that lead to programmed cell deaths like apoptosis. The third stage, which is the immune system dysregulation, basically this is the main stage that results in immunodeficiency, making the body more susceptible to opportunistic infection and certain types of cancers. The immune system becomes increasingly unable to mount effective responses to pathogens, leading to a range of clinical manifestations seen in late stage of HIV infection and AIDS. And then the last stage is the chronic immune activation. Even in the absence of active infection, HIV causes chronic immune activation, which contributes to inflammation and further damage to immune cells and tissues, complicating the whole clinical picture. The symptoms of HIV and AIDS. The symptoms of HIV and AIDS basically depends on the stage of where the patient is, or how long the patient has had it. We have the acute HIV infection, which is basically within the first 2 to 4 weeks, where you can see symptoms like flu-like symptoms. You can see fever, headache, fatigue. We can also see swollen lymph nodes here in this stage. So the person can take it as a normal infection, or maybe in an upper tract respiratory infection, and they won't go to have a test. So in this case stage, they are even more likely to transmit this infection to other people. So it's one of the most dangerous stages as well. And then we have the clinical latency. This is the asymptomatic phase, and can last for several years. The patient is also very much susceptible to transmit diseases to other people as well. And the virus remains active but reproduces at a very low level, hence the asymptomatic things. So you can see fever, chills, headaches, night sweats, sore throats, muscle aches and pains, joint pain, fatigue, swollen lymph nodes mainly in the neck, and also mouth ulcers. And a lot of patients also don't experience any symptoms as well, but these are just the main symptoms. The progression of HIV to AIDS. This happens when the immune system is completely depleted or damaged, and the symptoms of this could include rapid weight loss, recurring fever or profuse night sweats, extreme fatigue, prolonged swellings of the lymph nodes, diarrhea lasting more than a week, as well as opportunistic infections or cancer such as pneumonia or Kaposi's sarcoma, which are very rare in individuals with a very healthy immune system. The diagnosis of HIV/AIDS. There have been a lot of tests brought up to help in diagnosis of HIV, but the three main tests are the antibody test, when we detect antibodies produced by the immune system in response to the HIV virus. And then we have the antigen or antibodies test, which can identify both HIV antibodies and the HIV antigens as a part of the virus. And then the last test is the nucleic acid test, which detects the virus itself and are used in very, very specific situations, such as recent exposures. Early diagnosis is also very, very crucial for the effective treatment of a patient and preventing transmission to others. Some other treatment methods include, I also said in the beginning, antiretroviral therapy is one of the main methods for used in treatment, which was discovered in the year 1990. Yeah, 1990s. Yeah. I said it in the beginning, like the 1990s. Yeah. And it's a primary treatment form. This therapy includes taking a combination of HIV medicines every day, and it helps lower the viral load in the body to an undetectable level, and which means the virus cannot be transmitted to sexual partners, and the person can stay undetectable for a while. Doctors also use this therapy when after coming in contact with patient blood in some cases till they get their results back from the lab. And adherence to ART is essential for maintaining health and preventing the progression to AIDS. While ART is very effective, it may have side effects such as nausea, fatigue, and maybe any other health concerns that you may get after receiving this therapy, and which should be discussed with your healthcare provider. No, you can put the person. And some prevention strategies. Preventing HIV involves very several strategies. We have safe sex practices, using condoms consistently and correctly during sex significantly reduces your risk to HIV or AIDS. Pre-exposure prophylaxis, this is PrEP. Basically, this is taking a pill to prevent yourself or protect yourself from getting HIV from other people. From getting HIV from other people. This is for people that have like very active sexual lives. You get. And then we have harm reduction. These are like programs that provide clean needles to people who inject drugs. And then we have regular testing, and which is basically encouraging routine HIV testing to know one's status and that of your partners. And then the most important is basically education. When people know more about the disease, they can easily prevent these diseases from being transmitted to themselves as well as some others as well. So education or enlightenment is a very, very important part of the prevention strategies for HIV/AIDS, whereby community outreach programs to raise awareness and reduce stigma are done. Then we have the global impact of AIDS. AIDS continues to have a very profound impact on the global sphere as of 2021. Approximately 38 million people were living with HIV worldwide, and the sub-Saharan African region continues to be the most affected region. The epidemic has strained healthcare systems, increased healthcare costs, and affected economic stability. Organizations such as the WHO or UNAIDS play very vital roles in addressing this epidemic and also in its treatment and prevention efforts. In conclusion, understanding AIDS is essential for combating the epidemic and supporting those affected by recognizing transmission methods, symptoms, treatment methods, and as well we can work towards more prevention methods and reducing stigma and provide a more compassionate care for people living with HIV and AIDS. And this also lets us educate ourselves and advocate for research, awareness, and accessible healthcare for all. Thank you. Do you have any questions? Thank you.